morning. My name's Alyssa. I'm going to be your student nurse today. We are going to be doing a head-to-toe assessment. So just before we get started, I'm going to wash my hands and make sure the door is closed to provide privacy. Okay, sir. So before we get started, let me raise your bed. And then can you tell me your first and last name and your date of birth? I'd confirm on his wristband. Perfect. All right, so I'm going to ask you a few silly questions. Just try your best to answer them. Do you know where we are today? Do you know what day of the week it is? And do you know what the reason we are here for? Perfect. Patient is alert and oriented times 4. Do you have any allergies, especially to latex? No? Okay, perfect. So at this moment in time, I'm doing a general assessment of the patient as well, making sure they are well groomed, their breathing is not labored, speech is not slurred, and they don't seem to be in any distress, including anxious or depressed. From this point on, I will start assessing my vitals for the patient because their behavior is appropriate. So first, I'm going to take the oral temperature. I will put a plastic applicator on and place it sublingually under their tongue. Perfect, 98.7. I'm going to take your blood pressure really quick using the correct size cuff. Perfect, 120/80. I'm also going to take your radial pulse. For this, I'm going to count for 60 seconds. At the same time, I'll be watching my patient's chest rise and fall without them knowing for another 60 seconds, counting their respirations. Perfect, pulse is normal at 77 and respirations at 17. Now I would assess for pain. So are you in any pain today on a scale of 0 to 10? 0 being no pain at all and 10 being the worst pain possible. If my patient has no pain, I would move on with the assessment. However, if they do have pain, I would use OLDCART to assess that pain, which is onset, location, duration, characteristics, agitating factors, relieving factors, and time. So since the vital signs are all normal, I can move on with the assessment. Are you okay with me touching your head? Perfect. So I'm looking for any lacerations, lesions, bruises, making sure the hair is intact. Any lice or parasites across the head, everything looks good. Then I would move on to the ears, making sure there's no buildup of serum, no bruising, no lacerations or anything around the edge, and that there's no hearing aids. I'd move on to the nasal area, which I see that there is a nasal cannula. However, I would look for any nasal flaring. Make sure the mucous membranes are pink, moist, and intact, and that there's no deviation of the septum. I'm going to test your cranial nerves at this point in time. First, I'm going to look for accommodation. I'm going to hold my pen up and have you focus on the tip of my pen, and then I'm going to have you look up and focus at the clock, and then you'll come back to my pen, okay? So first, can I have you straighten your head, focus here. Now look at the clock. Perfect. Now look back here. Perfect. Pupils accommodate to distance. Now I'm going to check your cranial fields of vision using the star-like pattern. So keep your head straight and just follow the tip of my pen with your eyes. Okay, so I go from the center to each side, ensuring that the pupils are following briskly with no nystagmus. Perfect. Now I'm going to test for pupil constriction. I'm going to flash a light over your eyes, just continue to look forward. So I'd flash one side looking at this way, Again on the other. Look at the light, and then look at the opposite side. Perfect. At the same time, I'm checking the sclera and the conjunctiva, making sure that the sclera is white and the conjunctiva is pink. Pupils were moving briskly when I assessed them, and they were equal, round, reactive to light, and accommodating. So now I would move on to the oral area. I would look for any cyanosis around the mouth. I would look at the mucous membranes, making sure they're pink, moist, and intact. There's no oral dentition or cavities. I would ask my patient to stick their tongue out and say ah, ensuring that the uvula was moving up and down. Perfect. Next, I would ask the patient to smile, to frown, puff their cheeks out, and raise their eyebrows up and down. Perfect. If I wanted to, I could assess their eyes using the Snellen chart. At this point, cranial nerves 2, 3, 4, 6, 7, 9, and 12 are all intact. I would check the neck by palpating the carotid artery, both sides, but separately to ensure that I don't cut off blood supply to the head. I would check for any tenderness in the lymph nodes and have them turn their head to check for jugular vein distension. Can you shrug your shoulders against my resistance? Perfect. Now I would move on to the upper extremities of my patient. I would look for any bruises, lacerations, lesions, lines, as I see here in IV. Make sure there's no edema. Make sure the skin color is at baseline for the patient. There was no heat. Skin is dry and intact. I would check the fingernails for any clubbing. Make sure the nail beds are pink and capillary refill comes back within 3 seconds. I would test grip strength. Ask them to squeeze my fingers at the same time. Grip strength is equal bilaterally. Have them push up against my hands. Have them push down against my hands. Strength is equal bilaterally. Can you bend your elbows for me? Flex your wrists. Perfect. Arms up, down, out to the side. Perfect. Active range of motion is intact. Next, I'm going to move on to your thoracic area, which means your chest. I'm going to listen to your lung sounds. First, assessing your anterior lung sounds. And I will check bilaterally to ensure that they are equal. Checking all lung fields on both sides. I would also assess the lateral lung fields. Perfect. Now I'm going to listen to your heart sounds, starting at the second intercostal space on the right-hand side. Listening to your aortic, moving to the left of the second intercostal space to pulmonic, down to the fourth intercostal space at the tricuspid, and to the fifth intercostal space at midclavicular line for the mitral. At this point, I would also be listening to the apical pulse for 60 seconds. I would flip to the bell side to listen for any murmurs or bruits. Lung sounds were clear to auscultation with no adventitious sounds, including wheezing or crackles. Heart sounds were regular, and there was no labored breathing in that process. But heart sounds were regular with no murmurs or bruits noted, and no dysrhythmias. So now I would move on to the patient's abdominal area. I'm going to expose you for a moment, ensuring to not expose the patient for too long, keeping them covered as well as possible. I would start by inspecting, and then I will auscultate, and then I will palpate. I'll ask the patient if they are in any pain, and ensuring that I inspect that area last, or palpate rather that area last, to ensure that I don't irritate it even more. So I'm going to start listening to all 4 quadrants, starting at the lower right, ensuring that the ileocecal valve has the most activity. I would flip to the bell side, listen for any bruits, which are not noted. bowel sounds are active in all 4 quadrants with no bruits noted. I'm going to palpate all 4 quadrants again. At the same time, I'm going to palpate the epigastrum and the suprapubic areas. I would ask the patient when the last time they voided was, checking for any bladder distension, and when their last bowel movement was. I would cover the patient up. At this point, I can also check the peri area discreetly, ensuring that skin is intact. I would start by looking at the legs, seeing if there's any swelling, edema, lesions, lacerations, bruises, any redness in the calves, any swelling. I'd ask if there was any pain in their legs, and I would ensure that the skin tone was at baseline for this patient's condition. So I'd check the temperature. Skin is dry and intact. There's no edema. Perfect. I would check for the dorsalis pedal pulses on both sides, equal bilaterally. Check for any clubbing. Capillary refill comes back within 3 seconds, and nail beds are pink. Can you push down on my hands? Can you push up on my hands? Can you bend your knees? Can you move your ankles? Perfect. Active range of motion is intact. Cover their feet back up. At this moment, I could also have the patient get out of bed and watch them ambulate to the bathroom, checking their gait, looking for balance and strength as they walk. Then I would assess the back of my patient, first pulling them slightly towards me to ensure that they don't hit their face against the rail. Perfect. Then I'm going to auscultate your posterior lung sounds. So I would place the patient's leg. Okay. Assist them over. I would listen along the sides of the spine, between the scapula and the spine, ensuring I'm hearing the actual lung sounds. I'd reassess the lateral lung sounds, ensuring that what I heard was correct the first time. Lung sounds are clear to auscultation. I would also be checking the scapula, looking for any redness, lacerations, lesions, bruises, pressure ulcers, for any adventitious signs, and I'd also check the coccyx, because these are the bony prominences, making sure there's no pressure ulcers, redness, lesions, lacerations, or bruises. Roll my patient back and adjust them into bed. And cross their legs. Ensure that they're comfortable. I would ask my patient if they had any questions. I would lower their bed to the lowest possible position. Turn on the bed alarm, wash my hands, and document.